Hello and welcome to today's edition of Diplomatic Passport, your daily weekday COVID-19 show that keeps you up to date with Zimbabwe's COVID-19 effort, as well as regional and international trends around the pandemic. My name is Blessing Munatsi, and this program is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. And we start by taking a look at the latest figures released by the Ministry of Health and Childcare. Yesterday, 23 new cases of COVID-19 were recorded from 981 tests, representing a 2.4% positivity rate. And this takes the number of active cases to 599. The cumulative number of COVID-19 cases now stands at 132,997, while of these 127,700 are the recoveries. 71 cases were recorded over the weekend, and a single death was also recorded yesterday. Takes the number of active fatalities to 4,678, and 3 deaths were recorded in total over the weekend. Zimbabwe currently has 29 hospitalized cases of COVID, and 2 are new admissions, and 9 are symptomatic, and 19 mild to moderate cases. And one of those that are admitted have severe symptoms, while there are no current admissions in the ICU. Now, moving on to the vaccination program, 3,783 people receiving their first dose yesterday brings the cumulative for the first dose to 3,310,575, while 4,417 received their second dose to bring the cumulative for those fully vaccinated to 2,595,159. So just slightly under 20% of Zimbabwe's population fully vaccinated, according to these figures. Looking at the global trends, the global death toll for COVID-19 has now topped the 5 million mark, nearly 2 years into the pandemic that has not only devastated poor countries but also caught wealthy ones with first-rate health care systems by surprise. The US is not just a leader in the overall deaths but also in new death cases. Since July the 7th, more than 131,000 people, that's the new deaths, were added to the total, counting for 17.8% of all deaths. And Indonesia added more than 80,000 deaths, accounting for 56% of the total deaths, while Brazil added more than 77,000 and 13% of the total deaths. Mexico and India each saw an excess of 50 deaths recorded. Of course, these figures talking, of course, to the populations, the high population of the respective countries that are being talked about. The increasing number of deaths, however, in the African region is combined with the slow vaccine rollout, and creates a concern not only for the World Health Organization but most governments. Just 10 countries have been able to fully vaccinate more than 10% of their population, and Seychelles is leading the way, more than 3/4 of their total population are fully vaccinated, followed by Mauritius 66%, Eswatini on 20%, South Africa 20%, Zimbabwe just below 20% on 18%, and 4 countries have yet to fully vaccinate 1% of their population. Also looking at the global figures, more than 7 billion doses have been administered to date, and 3 billion of those are for the fully vaccinated, accounting for 39.1% of the global population that is actually fully vaccinated. Let's come back to the local front. There seems to be a decline in the number of COVID-19 cases, also the number of vaccinations that are happening, the number of tests that are being conducted on a day-to-day basis. This could also be an issue of laxity on the part of members of the public, and the National COVID-19 Task Force Chief Coordinator, that's Dr. Agnes Mawomva, says health authorities have noted with concern a general reluctance by Zimbabweans in observing the COVID-19 protocols and preventive measures, and actually has warned that the behavior will plunge the country into a deadly 4th wave of coronavirus infections. And according to the government, an average COVID-19 daily cases have gone down from a peak of about 2.6 that was 2 months ago to around 50 currently daily being recorded now. A fact health authorities believe could be causing reluctance amongst members of the public. Here is Dr. Mawomva.
very clear when you walk the streets, when you go to approved and allowed gatherings, that people are just throwing away their masks. They're not social distancing, and sanitizing is almost like people are forced and they don't do it properly and all that. We're urging people of Zimbabwe, we are not out of danger yet. Our experience in the past, where we had the first wave, the second wave, and third wave, clearly indicate that each time we relax, that's when we're hit by a fourth wave. So the relaxation that we are seeing, the complacency that we are seeing, is most certainly going to lead us to a fourth and bigger wave.
All right, let's look at the issue of antibody titers. This is the topical issue that then talks to whether there is need for a booster vaccine. In other words, the third shot for most people that have been vaccinated. Does the number of antibodies in your body decline with time? Well, Zimbabwe last year started a countrywide antibody surveillance exercise, which is being run by the Ministry of Health and Child Care. Up to 8,000 people will be taking part in the studies, and antibody tests can actually show who may have had COVID in the past infections. Antibodies can also develop, as you may be aware, after receiving the COVID-19 vaccine, which is the artificial immunity, and the program does aim to improve understanding of the protection provided by antibodies generated following the COVID-19 infection, which is the natural immunity, versus vaccination, which is the artificial immunity. Participants will be required to take 2 tests, one immediately after a positive COVID diagnosis and another one 28 days later, in order to measure the difference in antibody titers present over time. And Professor Nicholas Midzi, who is the director of the National Institute for Health Research, gave us an update on the progress so far.
It was concurrently noted by the Cabinet of Zimbabwe that the seroprevalence survey would better inform the country on the extent of the distribution of the disease or the spread of COVID-19 in the country. And hence the Cabinet requested that the survey be implemented in a short space of time in order to advise for policy formulation and the strategies. We are going to conduct laboratory tests that are going to be done on spot using the rapid diagnostic kits for the diagnosis of SARS-CoV-2 or detection of SARS-CoV-2 antibodies that are specific, including IgM and IgG. So the RRDT has already been donated to Zimbabwe following our expression of the desire to implement the seroprevalence survey. Can be able to tell if we have a large proportion of our population having been infected, then or having been exposed to infection. Then simply it means then that we have the herd immunity, simply meaning that the disease could be with us in circulation in the community, people being infected, but it does not cause severe complications much. Unlike when we have it's just like a flu, like one of those flus that can take others to bed, and here and there some of the individuals with underlying conditions can be taken to bed and they can actually lie and rest. They can pass on. But what then it could mean, if we have herd immunity, it means then we are protected now by the exposure to infection. And to what extent? That's what we want to establish.
So that's research into antibody titers to determine how long antibodies actually remain active within your body and whether they are up to therapeutic levels well beyond vaccination dates. And of course, this is quite in line with the government position that Dr. Agnes Mahomba has also been highlighting, that they are going for a fact-based scientific approach in as far as all the decisions that they make when it comes to antibody titers. I'm sure this issue was also raised for those people that were failing to get their second dose, especially for Sputnik, and the preliminary will be that the antibody titers will have to be assessed first before we can determine whether one needs to then move on to Sinopharm or Sinovac before getting their second jab. Well, Diplomatic Passport comes to an end for today. This show is made possible by ZTN's partnership with the Ministry of Information, Publicity and Broadcasting Services. My name is Blessing Munadzi. It has been an absolute pleasure. We're back again tomorrow, same time, same place. Do make a date with us. Until then, it's bye-bye for now.